Good afternoon. This is Cynthia Kanaki with the ALS Association. Welcome and thank you for carving time out of your day to join us. This webinar is one of a series of monthly webinars focused on bringing information of a practical nature to those living with ALS. Given the frequency of questions related to mobility and some of the other challenges associated with ALS, we're pleased to share information today about the ALS Focus Survey on mobility and find out why we need to learn more from you about your experiences. For your convenience, the webinar and the associated slide deck are recorded and posted to the ALS Association website for post-live presentation viewing. Please give us 24 hours to get that posted for you. Before I introduce our guest speakers, let me invite you to participate in our webinar by posting comments or questions to the question box. I may be able to answer your question privately, or I can share your comment or question with our audience during the Q&A session. And because we continuously strive to share information that you find practical and valuable, we invite you to complete a brief 3-question survey that will appear on your screen immediately following the webinar. All the responses will be submitted anonymously unless you include your name or email in your response. So let me introduce today's speakers. Amanda Lee is Associate Director for the ALS Focus Program, a survey-based research program. Amanda has a background in public health and community engagement. Ron Ferretti is current chair of the ALS PC, a veteran and a person with ALS. Please join me with a warm welcome for our speakers.
All right. Hi, everyone. Thanks so much for having Ron and I here today. It's really great to be able to speak with you all and talk about who we are, what ALS Focus is, why it's important, and what our newest survey is all about. We hope after listening to this, you'll sign up for Focus and take the Mobility at Home survey so we can learn about your experiences with in-home mobility equipment while living with ALS. And I'll hand it off to Ron to talk about, just give a little introduction of who he is.
Hi, my name is Ron Ferretti. I'm chairman of the PSAP, the Patient Caregivers Advisory Committee. I'm a 27-year veteran of the Air Force, and then after I left the Air Force, I went and became finance director for South Carolina's 8th largest city, the city of Goose Creek. I was diagnosed in October of 2016. I'm a very lucky ALS patient in that the disease moves pretty slow in me. I have a problem walking, but I can use my hands. Obviously, I can speak. It's nice to have it slow. So the committee really works to try to make life better for all of us with ALS. Whether it's slow moving or fast moving, we want to make it a livable disease.
Thanks, Ron. And I'm Amanda. As Cynthia said, I'm the Associate Director for ALS Focus. I've been here since last June. I have experience in public health research and community engagement, and I currently live in Tucson, Arizona. And just here's a picture of me and my dog in Tucson. So for anybody who hasn't heard about Focus yet, this is an online survey program through the ALS Association. The surveys occur throughout the year and focus on different research topics based on people's experiences, such as their experiences with telehealth, caregiver needs, mobility equipment, and so on. Our goal is to learn as much as possible about individual needs and preferences throughout the disease journey, so the whole ALS community can benefit from the amplification of collective experiences. Through focus surveys, the association is able to create a database of important information provided directly by people living with ALS and their caregivers. Researchers, program administrators, legislative advocates, and policymakers can use the data provided through focus to improve research, care, programming, and policies. People with ALS, current caregivers, past caregivers, are all eligible to participate in ALS Focus surveys. And proxies can respond on behalf of someone with ALS at their request. Participants in Focus have to be over 18 and live in the United States. And the surveys are in English and conducted online, so they can be done in the comfort of your own home. ALS Focus is driven by people with ALS and caregivers who participate in our patient and caregiver advisory committee, people like Ron. The PCAC provides strategic input for the focus programs, such as selecting survey topics, designing and reviewing questions, and recruiting participants. This helps the program stay grounded in issues that are most pressing to members of the ALS community. We also have partners from academic universities, federal government, and industry who bring their expertise into the program. We collect experience and preference data into the Focus database, which can then be used to inform programs and policies at the association and beyond. For example, last year we ran a survey on insurance coverage for ALS care. We asked people about their experiences with prior authorizations, claims, denials, and appeals with their insurance companies. This information is being used to develop a toolkit to advocate for more coverage of ALS care. And so this is, one way that by promoting focus data and results, we can have impact and influence. We can expand things like patient-focused drug development, telehealth policies, equipment programs, and so much more. The data we collect is kept secure and confidential. An outside committee called an institutional review board oversees our program to make sure our standards for protecting people's information are rigorous. This is really important to us. To keep the data anonymous, each participant receives a unique neurostamp, which is a random code of letters and numbers. This ensures that the data is de-identified, which means people's names and personal information are not attached to their survey responses. Using the neurostamps, data from focus surveys can be compared with data from other research studies that use those stamps while remaining anonymous. De-identified focus data files are available for the public and ALS researchers to use for free. By making the data publicly available, we're fostering open science, which is crucial for diseases like ALS. Researchers can analyze focus data by different factors, such as by region of the US, demographic information, ALS disease progression, and so forth. We want this data to expand the possibilities for discovery in ALS research and to serve ALS advocacy and care. The results and data files from previous surveys can be viewed on our website. So why is ALS Focus important? We really need you to participate to ensure that we're collecting data that's representative of the entire ALS community. And I'm going to pass it to Ron just to talk about his experiences with Focus and being on the PCAC, and the importance of increasing our participation in numbers in ALS Focus. Ron, yeah, I'll pass it on to you.
Thank you, Amanda. The important thing about the PSAP really is, and I've said this many times, if you don't have ALS, you really don't know what ALS is. And I'll give you an easy example of it that just passed Congress a couple of months ago. If you were in a wheelchair, Medicaid or Medicare wouldn't pay for that wheelchair to elevate. You had to pay for that out of your pocket. Well, enough people finally complained and they started paying for it. But we had to do some letter writing, some emails, and I put in my email a simple statement: bring your kitchen chair over to your cupboard, sit in your kitchen chair, don't get up, and take everything out of your cupboard you can take out of your cupboard. And you amazingly find out there's not a lot you can get out of your cupboard. So what we want to do with these surveys is we want to expand people's knowledge about what we're going through. There's a tremendous amount of difference in equipment that's provided by the Veterans Association to veterans versus the quality of the equipment that Medicaid and Medicare will pay for. All of this public policy that we're trying to shape really is to benefit the patients and help make life much more livable. For example, if you're in a wheelchair and you go to a hotel, there's a federal law that says all doors have to have a pull of 5 pounds or less. Except there's also another federal law that says all hotel doors have to be fireproof. And part of the way they make them fireproof is they put these large door pulls on them if it's not a specially made door. Almost impossible to get in with a wheelchair. You can push the door in, but when you try to go out, it doesn't work. So what we do with these clinical trials are not clinical trials, but these programs surveys we do, is to get people doing it. Now, the problem, and Amanda's going to get to it later, but I want to steal her thunder, is we don't have enough people doing it. We have somewhere in the neighborhood of 30 to 35,000 people with ALS. We've only had 2,000 people do the 10 surveys we've done. So we need to get that number up so that we can get the things that people with ALS need to make their life a more livable life.
Thanks, Ron. Yeah, so Focus started in 2020 and we have launched over 10 different surveys. We have over 2,000 people who participated in the past few years, but as Ron said, we're really pushing and wanting to ramp that number up and get as many people as possible to participate in Focus. The more people we can get registered and responding to our surveys, the more responsive and accurate our research can be. This is an avenue for people to share their needs and perspectives in ways that have an impact on advocacy efforts, care services programs, policies, clinical trials, anything that can use data to inform the kinds of projects that they're doing to contribute to the ALS community. So yeah, I echo Ron's statement. Please participate in Focus. We want to get as many people as possible. And I quickly want to just review some of the accomplishments we've had from Focus. First, what have we learned from our past surveys over the past few years? Here are a few key findings from previous surveys, although there are many more important things that we've learned that wouldn't fit into this presentation. So 1 out of 4 people with ALS and caregivers have experienced debt or had to borrow money due to ALS treatment or caregiving. And out of 15 different ALS symptoms and functions that we've asked about in our surveys, the inability to do activities and limitations with mobility or walking mattered most to people with ALS. And as Ron mentioned, prior to the recent Medicare decision to cover electronic seat elevation, nearly half of people with ALS and caregivers said that insurance had refused to cover that component on their power wheelchair. 20% thought that they or the person that they cared for also should have started using their power wheelchair sooner than when they finally received it. And 1 in 3 people who had submitted a prior authorization or claim to their insurance for ALS care had been experienced being denied before. And prescription medications or medication supplies were the most commonly denied things by insurance. So these are sort of the things that we learn from the surveys. And then the next question is, what do we do with that? And so here are also a few impacts we've had with ALS Focus, although again, this is just a small snapshot of a much bigger picture of the impact that we've been having. So this past year, the association submitted ALS Focus data on Power C elevation in public comments to the Centers for Medicare and Medicaid Services when they were assessing evidence on the medical necessity of Power C elevation. And so this is what Ron was talking about. Ultimately, they decided to cover the cost of Power C elevation, which is very exciting and important. And we're really proud that the focus data could have been considered in that evidence. And that's really, that data came directly from people with ALS telling us about their experiences. In 2022, we also had our focus survey that was designed to inform an evidence-based resource guide for educating insurance providers on the importance of covering the costs of ALS care early and often. And that resource guide is still being developed and shared so that it can be used to advocate for that coverage. And finally, all of our focus survey results and public data files were provided to the National Academies of Sciences, Engineering, and Medicine, their committee for their study on accelerating treatments and improving quality of life in ALS. So that's a way that our research is having an influence on even more research in the community. These are just a few ways that the data is being used. There are many more. Our team continues to engage with researchers at conferences and through partnerships to leverage the data to make as big of an impact on ALS care as we can. Hopefully, after hearing all of this, you're asking yourself, how do I participate in ALS Focus? And it's very simple and easy to register. You go to www.alsfocus.org and click on the big red button that says, click here to take ALS Focus surveys. And that'll take you into our survey platform called Qualtrics, where you'll follow the instructions and answer questions from there. And so again, any person with ALS or a past or current caregiver who's over 18 and living in the US is eligible for Focus. And if you want more information on the website, there's a step-by-step guide on how to register. And you can find a lot of other information there too, such as, who's part of our advisory committee and our public data files and all of that information that you might be interested in. While I have you here, I also wanted to talk about some of the similarities and differences between ALS Focus and the CDC Registry. We think it's important to clarify these because they do have a lot of similarities and can be confused, but you probably have heard of the CDC Registry. It's another research program run through the CDC for people living with ALS. And like Focus, the registry also involves surveys that ask about life experiences. Both programs report our data anonymously, are IRB reviewed, and use neurostamps to de-identify participants. There are some differences that are important to note. Focus has new surveys on different topics throughout the year, with the goal of capturing people's needs and opinions on those topics. The National ALS Registry counts cases of ALS and analyzes environmental risk factors. So you only participate in the CDC Registry surveys one time, while Focus surveys are ongoing. The Focus data is free for anyone to use, while registry data must be requested from the CDC. Focus is also, as I mentioned, open to caregivers, while the registry is just for people with ALS. Both programs are super important to participate in, and that's just why I want to mention it here. So researchers can understand more about all the different aspects of ALS, environmental risk factors to access to mobility equipment. And on that note, I want to talk about the results of one of our past studies that's also related to mobility. In 2021, we ran the ALS Mobility Survey, which focused on access to mobility equipment for getting around outside of the home in particular. And for this survey, we focused on power wheelchairs, portable ramps, and rollators. The survey questions asked if the person with ALS currently uses or ever used each type of equipment, how'd they get the equipment and pay for it, and whether the equipment met their needs. 352 people participated in that survey. My colleague Sarah Parvanta covered the results of the survey in detail in a previous Living with ALS webinar, but I'll just quickly summarize some of the key findings in case you haven't seen that. The results of this survey showed that 1 in 4 participants paid for at least some of their power wheelchair costs out of pocket. And as I mentioned earlier, about half said their seat elevation was not covered. About half of participants paid out of pocket for their portable ramp or rollator, and 16 to 26% of participants thought they should have started using their equipment sooner. The survey revealed that although most people felt their equipment met their needs, 11 to 18% of participants still disagreed that their needs were met by their equipment. We learned that lack of awareness, malfunctioning equipment, delayed delivery, and other barriers hindered people from fully utilizing their equipment. And these findings suggest to us that more can be done to ensure that mobility equipment is allowing people with ALS to engage with the world in the way that they want. A significant number of people reported that they get equipment from the association's equipment loan program, indicating that this is a key resource for equipment that we want to keep supporting and promoting. And finally, as we've mentioned, this is the study where the data about power wheelchair seat elevation was used to get that covered by Medicare. And so that's really the kind of power we can have with Focus. And, again, echoing what Ron said, the more people we have behind that, the more powerful we can be. So because mobility is such a big part of living with ALS, we have a lot more we want to learn from the community. So we're following up on the previous survey with another survey on mobility at home, which we're excited to announce launched last week. This survey focuses specifically on equipment used for getting inside, out of, and around your home. And we spent a significant amount of time consulting with the advisory committee and care services staff members to develop survey questions. We feel the data from the survey will be a really important tool for understanding people's needs around in-home mobility equipment, and we'll use the results to advocate for better overall care. You can sign up for the new survey at alsfocus.org. If you've already signed up for Focus in the past, you can also look out for an email invitation to take the new survey that's going out later today. The survey takes about 20 minutes to complete and is open to people with ALS, current and past caregivers. Once you take the survey, we really encourage you to share it with others in your networks and communities. That has a big impact on, the amount of people we have engaging with the survey. It's open until October 23rd. And then I will ask, Ron, I'm going to pass it to you. You can talk about what the topics of the survey cover and your experiences working with the PCAC to develop the questions.
Well, there's many different ways to get in and out of your house if you walk. If you don't walk, then you have a problem. One of the things we realized early on in the surveys is that we could give someone a very nice wheelchair, but if they had no way to get out of their house, nowhere to go anywhere, all we did was we made them prisoners in their own house. So what we're doing in this survey is we're trying, or not trying, but we're showing what a person needs to get out and live. Remember that this year's ALS Association goal is to be able to live with ALS. Well, you can't live if you can't leave your house. So we've done that. Amanda mentioned earlier about getting equipment early. I worked with the federal government and the military and then local government, total between the two of 46 years. I have never seen governments or insurance companies, for that matter, be very, very proactive. However, the Veterans Association, for military veterans that have ALS, they give you equipment actually before you need it. They've given me a brand new wheelchair. I just got it about a week and a half ago. You can see marks all over my house from it because I'm learning how to drive it. Right now, I can get out of it if I get it stuck and get it unstuck. But if I don't get it until I can't walk, how do I get out of it and get it unstuck? How do I use a Hoyer lift, and a ramp? All of those things take time to acquire from the insurance, and they take money. They take, Medicare, Medicaid is going to charge you 20% for almost everything they do. But this is the kind of stuff that you have to have if you're going to be able to live with make ALS a livable disease. As you can see, the three pictures there, the man on the upper left, he's in an elevator. He's in a 2-story house or an elevated house, which you would have in Florida or South Carolina, to get into his house. The next picture over is a Hoyer lift that's used to transport you or move you from your chair to your wheelchair or to your bed or to the bathroom. And of course, we have the nice long ramp. But those things, as we said, cost money, but they're vital to the patients with ALS. So what we have to do is we have to get way more than 2,000 people doing these surveys, because 2,000 people doesn't get Congress's attention very much. 20,000 people will. And in all honesty, that's the only way we're going to change that.
Thanks, Ron. Yeah, I think it's really great to hear about your experiences getting, learning how to use the wheelchair early. That's something that I know we really want to advocate for. And in this survey, we don't ask about wheelchairs because we asked about it on the last survey, but we ask about 8 other types of equipment that people use in their homes, such as the lifts, different types of beds, home elevators, and we ask about, how you were able to access it, if you were able to access it, how much it cost you, the quality, how much is it meeting your needs? Did you receive it when you needed it? So we can sort of start to understand what kinds of issues people are facing, or if the kinds of things that are going really well. We also ask about home modifications and renovations, which we know is a really expensive part of living with ALS, to make your home accessible. And so through the survey, we hope to measure that the access, costs, and quality of equipment for people living with ALS, in terms of their equipment that they have in their home. Questions in the survey cover topics like, did you receive it on time? Did you need to modify your home? So that's just kind of what you can expect to answer in the survey. Again, it takes about 20 minutes. We worked with our advisory committee very closely to develop the questions, and also with care services staff at the association. So the questions and the equipment types have been carefully selected, and we thought a lot about trying to ask about the wide breadth of topics related to equipment while trying to also not have it take too long for you to go through. Our surveys are meant to be as accessible as possible. And so we really hope that you are able to take our survey and give us some insights into the equipment that you're using in your home, if you're using that equipment, if not, the reasons why. And that'll help us in understanding what we need to prioritize going forward at the association, and then other programs and research that also uses focus data. So thanks for taking the time to hear about what we're doing with Focus and to hear about this new survey. Again, we really encourage everyone who's eligible to register and take the new Mobility at Home survey. It's so important for making sure that your perspectives, needs, and opinions are included in the research, policies, and care programs that are happening. Only you can share about your experiences. So we need to learn from people living with ALS in order to know how to move forward. As I mentioned earlier, there's such power in numbers, and the more people we can hear from through the focus surveys, the more power our data can have, the more representative we can be of all regions of the United States, and the more effective the program can be. So Ron and I are happy to answer any questions. I want to thank, the people who participated in Focus so far and who will participate, hopefully after hearing this presentation. Everyone on our patient caregiver advisory committee, we couldn't do this work without them. Our steering committee and working groups who include our industry and academic partners, and other people, other groups that we're partnering with who share their expertise on Focus, and my colleague Sarah Parvanta, who's the director of Focus. This whole team is really important to making sure that the program is as successful as it can be. And all of these different people were part of creating the Mobility at Home survey. And so we're really hopeful that we can get the most amount of people we've ever had participating in a focus survey. I think that would be so great. So to reiterate, the survey opened last week and it'll be open until October 23rd. And we really also would love if you could share this information in your networks. Ron, do you want to add anything before we open it up for the Q&A? I don't know if you're speaking.
I just realized I was muted. One of the other things, focus is a wonderful thing, but the other thing anyone with ALS and any caregivers needs to do is to become strong advocates to try to get their states to budget money to use for ALS caregiving. There's some states that don't do anything. There's some states that do a little bit. We just succeeded here in South Carolina in getting $500,000 annually for that. The state of Michigan, I believe it was, did $23 million, but of course one of their legislatures died from it. So don't just do ALS Focus, but become an advocate to get money to cover these costs that we're, for lack of a better term, complaining about in Focus.
Yeah, that's a really great point. And also, one of our previous surveys did ask about caregiver needs. So that's a way, another avenue to be sharing perspectives, not only from people with ALS, but also from caregivers. We know that's a really important perspective. And we want to support things like Ron is talking about as much as possible. So Cynthia, if you Do you want me to take down the slides?
No, thanks. And actually, would you leave that up, please? Because I see that you have a link there to the ALS Focus program. And thanks so much, Amanda and Ron, for sharing information about this valuable program with us today. You know, one huge value of this program is that you're seeking information from subject matter experts. You're really going directly to the people that are diagnosed with ALS, the caregivers that are working with folks diagnosed from ALS. So I can only imagine how valuable that information is because you're getting it from subject matter experts. There were a couple questions that have come across my desk here. Well, here's one. Is each survey about a different topic? Can I pick what topic I want to complete?
That's a really great question. So when you register for Focus, everybody takes a registration survey that helps us create their neurostamp. And then everybody takes a demographic survey that helps us know a little bit about their background. And then the surveys that are on specific topics are only open for a short window. So if you sign up for Focus when we don't have an active survey open, then you'll just do the registration and demographics, and you'll get an email when we have a new survey open. So it's not, you're not like choosing, it is your choice what you want to opt into taking. If you get an invitation to take a new survey and you know, for whatever reason, the topic doesn't stand out to you, you don't have to take that, and you can still continue being a Focus member. But of course, we hope that our surveys will be on topics that people want to share their perspectives on. And so I hope that answers the question. Right now, if you register, you'll take the registration survey and then the demographics, and then you'll be invited to take the mobility at home survey until October 23rd when it closes.
Great, great. Okay, so people have to reach out to register to participate in this program?
They just sign up on alsfocus.org. So you just click on the red button that says click here to take surveys, put in your email, and then you'll get a link to participate in Focus directly to your email.
Great, great. Thanks so much. Another comment here. My husband passed away 3 months ago. Can I still participate? Now that I have more time, I have plenty to share.
Yes, that is so important to us. And past caregivers are eligible to participate in ALS Focus. And of course, we know that it's such a high intensity, busy time caring for someone. And so, like, if you're a current caregiver or past caregiver and you have the time to give to ALS Focus to share what your experiences have been like, we really want to hear from you. So the mobility at home survey also includes past caregivers. So each topical survey might have focus on a different group, but this one is open to all of our Focus members. And it's so valuable to us to hear, you know, what you went through accessing equipment. And I'm sure on future topics too, we want to hear about those experiences as well.
Great, thanks very much, Amanda. That's helpful. Question here. This is not specifically related to the Focus program that we're talking about today, but it's a question about how often can we get equipment from the loan closet? Is that something that you can address, or is that something your ALS colleagues can circle back and connect with this person asking this question about?
I can.
Okay, Brian.
Go ahead, Amanda.
Oh no, I was gonna say I'm not sure. So you can send me an email and I can try and connect you with the people who run that. But Ron, if you have more information, please share.
What I found in my own personal experience in trying to use a loan closet item when I was traveling is that it really depends on each area what they do. Some areas only loan out items in the loan closet to people that live in that area. Some will loan them out to people that are traveling there. And there's really a lot of not restrictions, but every area is different. And I believe it's based on what you actually have in your loan closet.
Thanks, Amanda and Ron. Actually, the equipment, loaned equipment should be available to people across the country. Sometimes that may be limited due to geography. And even more importantly, we want to make sure that the equipment loaned out is appropriate for your needs. In ALS, we know that it is often progressive, and equipment that may be appropriate in January may no longer be appropriate in June. So someone may need a different type of equipment. I will circle back with you directly so that we can get your question answered, area that you're living in. Another comment here, and Amanda, you mentioned something about people's privacy. So this really goes to that issue. How is the information private if it's shared with other researchers?
That's a good question. Yeah, privacy is super important to us with Focus. And as I mentioned, we have a review board who looks at all of our protocols and makes sure that it's safe, and it keeps the data that you share safe and confidential. So the way that we are able to share your information publicly without sharing who you are is through the neurostamp that I mentioned earlier. So it's a little complex, but when you take the registration survey, you are assigned to a random code. You don't have access to that code, but that is what we use in the data files. So when we release the data files, it has the codes, but it doesn't have anyone's name, contact information, anything like that. And the way that that's relevant is that another research study, like say CDC Registry, that uses the neurostamps, they have a code for you also. And there is a secure server that can connect those codes. And so a researcher who has access can pair your responses with what they have in their database without having to access who you are specifically, like your name and your email and all of that kind of stuff. I'm sorry, it's a little hard to explain, but that's sort of how it works. If you go on to our website and you go to the database with the data files and download one of our files, you'll see that when you download it, you can see all of the people who answered which questions and how they answered, but you don't see who they are, if that makes sense. And I'm happy to explain further, or my colleague Sarah is also on here and she can jump in if anything I said wasn't clear.
Great. So thanks for that explanation, because I know privacy is very important to many people these days. And you do have the ALS Focus at als.org. Is that just a standard email address? So if anybody has additional questions, they can reach out and use that email address to reach you?
Yep. Yeah, I look at that email inbox every day. So you can email me there and I'll respond as promptly as possible.
Perfect. So we have an email address for questions, and then we also have the alsfocus.org if you want to hop on that site directly.
Yes.
Just a couple more questions here. Thanks so much. Well, can I get on an automatic mailing list to get the surveys?
Yeah, so once you go to alsfocus.org and you click on the button to put in your email, then you're automatically on the emails from Focus. Then you don't have to go to our website anymore. After that, you'll just get invitations to our surveys directly to your email. But you do have to go to the website first and fill out the survey so we can get your contact information.
Great, perfect. Thanks so much. And then another question, do you need more committee members?
Yes, actually, that's a great question. We are encouraging more people to join the advisory committee. We would like to see new faces, new voices. You know, it's about 3 years old now, and it would be really great to see more people from different parts of the country with different perspectives on the committee who have time to give. So again, you can reach out to this email, alsfocus@als.org. And if you're interested in participating in the committee, please say that in your email. And then I'll set up a meeting to, see if we are a good fit. And yeah, you can get more information about participating in the committee.
Great, thanks.
Ron, I don't know if you want to share about like your experiences with being on the committee and sort of the time commitment.
Certainly. The committee really, there's not a large time commitment. We meet probably about once every other month, I guess. And unless we're doing a survey, and then we meet a little more often than that. But other than the Zoom meeting, the only thing you have is when we make the survey, we put it out there in a test platform. We go through it and we say, this is what we like, this is what we don't like. And we try to make the survey understandable for everyone. Sometimes it's a little difficult when you're using medical terms, but we try to keep it really simple. We try to keep it short. This one here is 20 minutes, which is a little longer than we like. We like 10 minutes, but there was a lot. I think this survey that's out there now is probably one of the most important surveys we've done, because we're chipping away at that big iceberg called healthcare, and we've got a lot of things in there that healthcare doesn't like a lot of. They don't like to pay for a lot of that stuff. So it's been a great experience, and I've met a lot of great friends through it. So
Well, thanks so much,
Yeah.
Ron. Obviously, your enthusiasm is infectious to elicit a question like that. So thanks so much, Ron. And yes, Amanda.
Oh, thanks, Ron, for sharing. It's really great to work with the committee. It's such a great bunch of people. And it's also super important to us to make sure our survey is tested by people with ALS and caregivers. Especially, if you're using assistive technology or anything like that, we want to make it as easy to use as possible, no matter what way you're using to engage online. If it's like through eye gaze or something like that.
Wonderful. So regardless of how you communicate, you really have options available to participate in the survey.
Yes, that's definitely our goal, to make it as easy as possible.
Great, great. And again, just the term ALS focus, clearly you are focusing on the subject matter experts, the people that live with the impact of this disease. I don't see any additional questions or chats in the chat box. If anybody has a final question, please post that. You are also welcome to visit the alsfocus.org website, or to share your questions or comments with Amanda and Ron directly at alsfocus@als.org. We sure appreciate everyone's time this afternoon. We know as we wind down the dog days of summer, people have lots on their schedules, so we appreciate you carving time out to join us. We would be most appreciative if you would complete the 3-question survey at the end of this webinar. Once the webinar closes, those 3 questions will pop up automatically. And the reason for this is because we want to make sure that we're bringing you information that's valuable to you. So please do stay on just for an extra minute or 2 to complete those 3-question surveys. Thanks so much. I want to thank Amanda and Ron again for their time sharing this information with us. And for everyone who's joined us this afternoon, please have a safe afternoon.
Thank you. Thank you so much, Cynthia and Ryan, and sorry, Ron. It's really, yeah, it was a great opportunity.
Yes, thank you for inviting us and giving us the opportunity to share this. And of course, thank you to Amanda, who does the bulk of the work in what we do this, to be quite honest. She not only has to deal with us, but she has to deal with the software company. So,
It's not a problem.
Well,
All right.
have a wonderful afternoon.
Bye.
thank you.